Yes, that was an important study, the results of which have now been presented at several meetings, which showed that there was a clear benefit in terms of relapse-free survival for Ipilimumab in patients with stage 3 melanoma compared to placebo. That was a very large, well-done randomized trial. I think it had something like 950 patients. And the data show that if you receive Ipilimumab compared to placebo, there's no question that there's a prolongation in the relapse-free survival. The medians went from 26 to 26 months from 17 months in the control placebo arm. And the hazard ratio was real. It was 0.75, and the p-value was very impressive because of the significant follow-up. I think the current follow-up is something like 2.7 or 3 years. So the p-value was 0.001. And these are real data, very impressive. And the data at ESMO that are new were the sort of the breakdown of benefit in different subgroups, some of which were post-hoc, some of which were planned, but it shows by substage of stage 3, all substages of stage 3 benefited from Ipi versus placebo. And if you had an ulcerated primary or didn't have an ulcerated primary, which in the trial was fairly well distributed. I think it was something like 40 some odd percent had an ulcerated primary and 50 some odd percent did not. All of those subgroups benefited. Again, confirming the fact that if you receive Ipilimumab for resected stage 3 melanoma as adjuvant therapy, you clearly do better in terms of relapse-free survival compared to those who get the placebo. No question that Ipi provides benefit.